I don't know how, like we touched on before, but oral health got somehow separated from general health, and that I have no idea how that happened. People just think it's a bit of a cosmetic thing. They're just pegs stuck in your jawbone, but they're actually connected to your body. You know, they are sitting inside bone with blood vessels and nerve supply, which means that they are connected to the rest of your blood vessels in your body. So they are connected, which is why, you know, we don't just, it's maintaining good oral health is not just about having that teeth that look nice, you know, it's about the fact that they can be risky to your overall health. So making sure, you know, if you have a big hole in your tooth, then you've got more bacteria in there. Bacteria can actually get into your bloodstream via your teeth, okay? And then once it's in your bloodstream, it can go anywhere, okay? It can cause you, you know, an infection, or you can become quite unwell, or it can go, but the bacteria can actually nest on other places in your body. So particularly often in your heart, the lining of your heart. It can nest on joints. We see a lot of people with that through the hospital, and then they get overall systemically unwell with fevers and increased heart rates and just lots of crazy symptoms, potentially all from a bug from the mouth. So that's why we really push that as well. So particularly good gum health is key, not just about the tooth itself, but gum health can, if you have a lot of inflammation in your gums, obviously there's long-term effects on the teeth, they get wobbly, but also having a lot of inflammation in your gums actually can make it difficult to control your blood glucose levels. So for people with diabetes, they have to really put a focus on reducing the inflammation there. Their blood sugar levels sort of go all over the show when they've got when their gum health is not good. Poor gum health has also been linked to cardiovascular disease. It can be pretty gnarly. And look, unfortunately, crappy things happen. There can be cancer and joint replacements, things like that, and you actually have to have a good standard of oral health before you can sometimes progress with treatments. So you never know when crappy things like that are going to come out of the blue, and then then things get a bit complicated having to manage you know, your teeth when you've just had these other health issues to manage as well. So just trying to maintain that, because again, it is part of your overall health, even if the health system doesn't recognise that.
Because the reason I asked the question before, because my hubby is type 2 diabetic, and he kept coming back with a headache, but he worked night shift. He didn't realise he knew that he has a little hole in one of his tooth, but he think it was because he's not sleeping and his sugar level is a bit up and down. And I said, no, I think you need to go and check. I asked him, do you have any hole in your teeth or any inflammation or something wrong with your teeth? He said, oh, I just got a little hole, but it's not my teeth. So I said, I booked an appointment and I took him. I said, I need you to go check because you've been to the doctor and he says nothing wrong with your head, but you keep having this headache. And surely we end up paying $1,500 to remove the tooth, and what else did they did? Fill a couple more right next to it. And I said, I told you a few months ago to go and check your teeth, but you think you're okay. And this is how much it costs us. And it's like a reminder. Everything does happen. It's like a reminder. Like you said, diabetic and heart condition. Again, if you have an infection there and they all go down here, it'll affect your whole body.